Hello, my name is Dr. Srikanth V. I am a practicing plastic and cosmetic surgeon. I practice at Manipal Hospital and at Clinique Belle at Bangalore. What is the post-operative care required for hair transplant surgery? The hair transplant surgery is a fairly straightforward procedure. It is done under local anesthesia. Following the surgery, there is some care that you will have to take to protect your transplanted head and also to protect the donor side from where the hair transplant has been harvested from. So I'm going to divide this into two parts. First is the donor side, that is from where we take the hair for the hair transplant. Now this part requires very minimal care for the first 48 hours or so. There will be a dressing on it. The dressing is held together by a tape. At the end of 48 hours, your hair transplant surgeon is going to remove the dressing and keep it open. In certain cases where we do FUT, that is the strip method, this dressing may not even be necessary. And after 48 hours, you can wash and shampoo the part and you can be completely normal. Coming to the top part of the head where the hair transplant is done, it requires a little special care. You need to keep it clean. You need to dab it with saline. Your hair transplant surgeon will tell you how to do it with gauze pieces and saline. And this is for the first 48 hours. Following this for a week, not much care is required. We wait for the redness and the swelling to come down. A week later, your hair transplant surgeon will tell you that you can shampoo the head so that it looks nice and clean and your hair will already by now would have started growing. I advise everybody not to do vigorous activity for the next 2 to 3 weeks, like lifting heavy weights, participating in very vigorous marathons or extensive cycling or very strenuous activity, so that we give the transplanted hair a chance to get firmly rooted into the new area. After all, they were growing in some other area all their lives. They've been put to a new area and they need to get accustomed to that new environment. So for about 2 to 3 weeks, I advise everybody not to undergo any vigorous activity. Regular walking, working at home, going to work, all that is permitted, but vigorous activity is only after 3 weeks. After this, your hair transplant surgeon may suggest some medical treatment for the next year or so to help the hair grow and also to protect your existing hair. And after a year or so, the hair transplanted hair doesn't require any care. It will grow, it will gray, you can cut it short, you can keep it long, you can braid it, you can color it, you can do anything that you do with the normal hair.